Good afternoon, everybody. Dr. Rob Silverman here, Amazon best-selling author of Inside Out Health and ACA Sports Council Chiropractor of the Year 2015. I'm excited to be talking about health hacks for 2021. I'm sure if I asked everybody that they'd love to put 2020 in the rearview mirror, and everybody's looking forward to a healthy, robust 2021. So several of my patients have asked me, what's the skinny, if you will? What's the new stuff, the best 8 health hacks that you could share with us for 2021? So I'm going to take about 20 minutes and then I'll answer any questions that anybody has at that point. So feel free to ask the questions. I'm going to take a look at those and let's go over some of the health hacks. Number 1 health hack, immune health. Believe it or not, what a surprise. That's not going to change. I think we'll be talking about immunity, and immune health for years to come. And it's an excellent conversation. It's really, the immune system provides 3 levels of defense against disease-causing organisms. The first one is our barrier system. We overlook that one often. The barrier system actually prevents entry. Skin and mucous membrane. So our skin is a barrier. Our mucous membrane is a barrier. Our stomach acid and our digestive enzymes, they are barriers. So a little bit about the stomach acid and digestion. The idea is stomach acid is hydrochloric acid. If we don't have enough hydrochloric acid, we usually can't break down proteins. We can't break down those proteins. They can damage the gut, and they can pass through the gut and lead you down a path of systemic inflammation. And digestive enzymes, like pancreatic enzymes. So stomach acids, hydrochloric acid, typically good to break down proteins. Pancreatic enzymes, really good to break down carbohydrates. And the other kind of digestive enzyme that you may want to know about is bile, which is great to break down fats. Then you get to the gut. 80% of your immune cells are in your gut. You hear it all the time. The gut is the epicenter of your health. Beneficial bacteria that live in the colon, it's called the gut microbiota. That's also a critical element. It creates a health providing ecosystem. So you want good bacteria. And you can get that through a good environment, decreasing your toxins, great diet, and great probiotics. But the immune system that we really talk about and what we want to balance and support is our innate versus our acquired immunity. Our innate immune system is a general defense. It's white blood cell oriented, and they're called neutrophils and macrophages. They actually engulf and destroy foreign invaders and damage cells. They're your Marines. They're your search and destroy type things. They come in and they attack everything. And you'll see that we'll be talking about it because there'll be specific blood markers that I'm going to talk about that go in hand with the innate and the acquired immunity. The acquired immunity, their specific defenses, they're actually B and T cells. The T cells come from the thymus, the B cells come from the bone. White blood cells called T lymphocytes target and destroy infected cells, whereas the B cells, they actually memorize specific things, and they're really called antibodies like IgG, IgE, and IgM. So number 1 thing you want to talk about is immune health. How do we enrich our immune health? Well, a lot of the hacks that we're going to talk about as we get through it actually does provide immune health, but some great lifestyle things, of course, is going to be diet. Limit your carbohydrates. If you eat carbs, don't eat too many at one time. Eat more whole foods. We're going to get to some other ones like sleep, etc. Some great immune boosting supplements, D3, melatonin, zinc, and pro-resolving mediators. The second thing that I want to talk about, a great health hack, is essentially treat your fascia. Now, what is fascia? Now, I do a lot of fascial work in my office. Fascia has grown in awareness through the manual therapy world. Fascia is what I like to refer to as the saran wrap of the body. So if you take the skin off a chicken and you pull it, the white that attaches the skin to the meat, that's your fascia. It's throughout your body. It's actually living matrix. The best way to describe it to a patient is it's your full body wetsuit. It goes through your whole body. It's connective tissue. It's sheath in the body. It's below the skin, as I said, and above the muscle. Lymph nodes, believe it or not, live in fascia. Nerves are in fascia. Actually, fascia, amongst all the other things, has 6 times the amount of nerve receptors than any other structure in your body. So it's clearly a sensory organ. Meridians are in fascia, and it does account for about 20% of your body's mass. So pain, back pain, and fascia. Interestingly enough, fascia plays a role in pain. It's actually the interconnected system. It transfers from one region to the other. It provides you the ability to slide. It plays a major role. So if this fascia is tight, you're not able to move. You're going to have more back pain. So one of the best hacks that you can have is enabling yourself to move your fascia. And you can do so by good stretching, some foam rolling, and having some soft tissue work like active release, instrument assisted, and even low level laser. Some specific things that'll help fascia are collagen and bone broth, water, omega-3 fatty acids. Healthy fats also help fascia health, like avocado and coconut. Foods that are high in antioxidants, and of course, taking magnesium, which softens a lot of muscle tension. Take it before you go to sleep, the magnesium. And interestingly enough, the fascial system is aligned with something that we call the sympathetic system. So when your sympathetic system is elevated, your fascia is tighter. Having said that, relax, meditation, things of that nature. Understand that the fascia is a critical element to overall health. Everybody next month is going to be going to their doctor, their primary doctor or their functional medicine doctor. In that, they're going to be starting themselves out on a blood test as a baseline for the year. Here are some blood test markers that I recommend everybody ask for. Number one, an inflammatory marker, interleukin 6. It's a multifunctional cytokine that plays a central role in host defense due to its wide range of immune activities and potent ability to induce acute phase response. This interleukin 6 is a great marker because it responds to infection and tissue injuries. It actually is aligned with what we call the T cells. And in that, it's a great inflammatory marker. Another inflammatory marker that I like is C-reactive protein. And the C-reactive protein usually comes out in the acute phase during an infection or inflammation. It is a tissue inflammatory marker. So once again, interleukin 6, C-reactive protein are some great choices. Vitamin D, believe it or not, is something that we're going to talk about in a moment, but tumor necrosis factor, that's another inflammatory marker. It's produced during acute inflammation and can actually lead to cell death. And tumor necrosis factor actually can produce interleukin 6. Your fourth marker that I suggest, now all these markers that I'm mentioning are on a standard blood test. It's not going to cost you anything extra. All the Quest labs, the LabCorps, and any kind of lab company does test for these. So homocysteine. Homocysteine is an amino acid in blood. It's a risk factor for cardiovascular disease and stroke. Low levels of specific B vitamins will show you an elevation in homocysteine. Once again, there's a marker that you can test for. Here's another one you can ask your doctors for, and that would be MTHFR to see if you methylate. Low methylation, high idea of homocysteine. And vitamin D. Vitamin D is hormone D. Vitamin D is a critical element to overall health. I just mentioned it before in reference to immune health. It's great for musculoskeletal. It has a gut-promoting health benefits. So to test your vitamin D, again, the levels of vitamin D you want to see over 30, but the sweet spot for me is between 45 and 65. Everybody should ask their doctor for what we call a vitamin D marker. Sleep. Sleep is the next hack. That is hack number 4. Believe it or not, that it's estimated 50 to 70% of million adults in the United States have chronic sleep and wakeful disorders. Sleep is a major problem. Sleep is where we have the opportunity to have restoration or consolidation of memories and reset our synaptic strength, and detox, where we can flush toxins from the body that build up during the waking hours. So sleep is when we can rejuvenate. Sleep is when we can detox our brain and get rid of metabolic waste products. Sleep is a critical element. Everybody should get 7 to 8 hours of good quality sleep. If we don't, believe it or not, poor sleep leads us down a very ruinous path towards chronic health conditions. The conditions that you'll see from poor sleep are heart disease, diabetes, mood disorders, autoimmunity, obesity, memory issues, immune dysfunction, and micronutrient deficiencies. So everybody's going to try and get better sleep. In addition, People with poor sleep have also shown to have those inflammatory markers that we just mentioned: tumor necrosis factor, C-reactive protein, and interleukin 6. The lack of sleep also increases what we call the Alzheimer's proteins. So you have more amyloid beta and tau tangles. So if you're not getting sleep, you have a higher incidence of Alzheimer's. Another marker you can check, and you should be asking your doc for one of your great health hacks, would be the APOE4 allele. If you have that particular allele, there's 3 different alleles you test for. The 4, you have a high incidence of getting Alzheimer's disease. So let me share you some good, everyday, implementable health hacks. One, for better sleep, you need to maintain a regular sleep schedule. Number 2, you need to establish regular, relaxing bedtime routine. 3, you need to give yourself about 30 minutes before you fall asleep. Don't expect just to fall asleep. So if you want to be in bed, obviously by 11:30 asleep, get in bed between 11 and 11:15. Sleep on a comfortable mattress and pillow. I cannot emphasize this more. The mattress is a critical element. You want a mattress that has body contour. You want to have open cell type of foam. And of course, you're always looking for a mattress that doesn't have any flame retardants. One pillow. Please, one pillow. So many people have 2 or 3 pillows. I want my head up. You want the one pillow so your neck is in a parallel position. If you want to detox your brain and your metabolic wastes most efficiently, the data indicates that sleeping on your side and your left side is the best position. You should be finishing eating 2 to 3 hours and maybe more before bedtime, because our next hack is going to be all about intermittent fasting. Everybody should be exercising regularly. You want to avoid caffeine, nicotine, and alcohol close to bedtime. Shut off all your electronic devices at least 1 hour before going to sleep. Those blue lights, the cell phone, which I just dropped right over here, poses an issue. The next hack, the 5th hack, is intermittent fasting. It may be the greatest hack ever, costs you nothing. Intermittent fasting, or as like I've talked about before, time-restrictive eating. Time-restrictive eating refers to the idea of fasting in a window during the day and eating during a window during the day. So I'm a big proponent of fasting for 14 to 16 hours during the day and eating in that other 8 to 10 hour period. So 8 to 4, 8 to 6. Those are the time frames in which I recommend. Of course, breakfast is a critical element. A lot of people like to wait till like 1, 2 o'clock. The literature isn't as effective for the intermittent fasting, time-restrictive eating when you do that. Now, in that time frame, in that 8 to 10 hour time frame, that doesn't mean eat pizza and junk. You still want to eat good, organic, whole foods, make better food choices. So your intermittent fasting, again, is an 8 to 10 hour period in which you should be consuming food. Intermittent fasting is shown to decrease blood pressure, decrease blood sugar, have a positive effect on cholesterol markers, have an overall positive effect on health, and is great for immune function. It's your body's own hack. What's really interesting is that intermittent fasting, if you do it for a period of time, allows for something called autophagy, self-devouring or self-cleaning of cells. You break down old cells, and from that energy of the old cell, you make new, fully enriched cells. So those old cells are kind of like a raisin. They look like they don't have much going on in there, kind of dried out, and the new cells through autophagy are going to look like grapes bursting with energy. So a great choice would be to have the intermittent fasting to allow for autophagy. Exercise. Let's get moving. 10,000, 15,000 steps. Now, it's interesting, I'm writing a book, and I've said that in my book, and some people said, well, what about intensity? What kind of exercise? Weights, flexibility, aerobic, yes, all the above. So let's talk about a couple ideas. The number one sign of aging, according to Tufts University, is a loss of muscle mass. So clearly we need to do some form of weights. Now, that doesn't mean going out and buying a weight set. You have your own weight, you have your body weight. So push-ups, squats, planks, pull-ups, these are all great body weight exercises. I was talking with a friend of mine yesterday, and we were talking about Jamie Foxx, and he's going to play Mike Tyson. Mike Tyson clearly was a powerful guy, carries a tremendous amount of muscle, and even though he just went back in the ring for an exhibition, he still looked really statuesque, if you will. And Jamie Foxx, who's in his early 50s is using weights, but he's using body weights, push-ups, pull-ups, all these things. He's not spending time under a bench press. He's not pushing weights overhead. And he said he's able to develop great muscularity through a diet and a good intensive, use the word intensive, exercise regimen. New study came out, it was 11 minutes of exercise a day was all that you needed to have an effect, a positive effect on your overall health. So everybody, let's get exercising. Let's get moving. Let's put time away during the day to exercise. If it's 11 minutes, you could 15 minutes. You still have 23 hours and 45 minutes left to live your day. And your day will be more enriched and you'll have more days, because that's what positive effects exercise has on people who perform good quality exercise. Hack number 6, talking about supplements, new supplements that are out there. Everybody wants to know what's the new thing. Who's the new kid in town? What's the new one on the block? That kind of stuff. So I think some of the newer things, or the newest thing, is peptides, without question. Peptides, and the idea of peptide is a short amount of amino acids. They're peptides. A long amount of amino acids, they're proteins. So peptides. So which ones do I recommend? BPC 157. That's the one that I've seen. That's the jam, if you want to use a word from Instagram. That's the new thing. Peptide has a significant anti-inflammatory modulating effect. Peptide promotes tissue healing through signaling pathways, and this is the beauty. Drugs stop signals. Nutraceuticals are volume. They turn signals on and off. If you can signal the body, you can signal the body for health. You can also signal down things that are adverse to the body. Peptides also upregulate gene transcription to influence healing factors. And in addition to that, there's no primary effect. It's not working directly on an organ. It's all about signaling BPC 157. So what does it influence? Well, it helps with repairing of tendons, repairing muscles, repairing intestines, repairing bone, repairing teeth, repairing the brain, and it also has a positive effect on the eyes. Now, BPC 157 also protects and prevents gastric ulcers. It's shown to really work to help the gut-to-brain axis, which is something very intrinsic to me and very important to me. It improves digestive function in IBS. It's also shown to help heal inflamed intestinal epithelium. It works with irritable bowel disease, and it also has some positive effect on the liver from overload of toxins. The other peptide that I think is going to take the world by storm in 2021 is NMN. NMN is a molecule to make NAD+. So it's a coenzyme, NAD+, that's needed in about 500 different chemical processes in your body, which happen quickly and typically smoothly. In the gut, NAD+ is a key to supporting the health of specialized stem cells that produce epithelial cells that form the gut lining. So once again, NMN is great for the gut and the gut-to-brain axis. So the production, unfortunately, of NAD, which you get from NMN, declines with age. So your stem cell activity. Now, we all know stem cell shots right now are starting at about $15,000. So you can do your own natural stem cells by stimulating NAD+ from NMN. Now, what other things can occur from NMN? Positive, strengthening endurance, body cell levels increase, DNA and cell repair, anti-aging, health, heart improves, weight control, and neurogenesis and cognition. So what other supplements that I've seen have a positive effect and I believe that are coming up in 2021? This one isn't new, but I think that the literature is coming out really making it a stellar addition to anybody's functional medicine pharmacy, if you will. And that would be resveratrol, because it has a plethora of polyphenols. It protects the heart, it protects circulatory system, it lowers cholesterol, it lowers blood sugar, it protects brain, and it's a great immune supporter. Quercetin. Quercetin has been overlooked for so long. Again, it's come up in the literature in the last 6 to 12 months. Without question, it's a superstar immune protector. It reduces inflammation, and it has a great effect on blood sugar levels. And last but not least, some basic easy hacks. So here's what I call the easy hacks. Drink enough water. We all forget to hydrate. So many of my patients are calling up and I'm real attributing a lot of their symptomology to what you would refer to as, unknown dehydration. If you have a gut problem, you probably have a dehydration problem. What would I add? Well, just, switch out the peanut butter and add the almond butter. Peanut butters are highly inflammatory. They're inflammatory. They're also an allergic food. Almond butter is a much better choice. What do you drink all day long? Well, you should drink water, and your hot beverage should be organic coffee. So regular coffee is full of pesticides. It's the most consumed beverage in America. Those pesticides are very damaging to your overall health. So great organic coffee. What I recommend is obviously Fit Grinds. Great choice. Go to fitgrinds.com. And, if you're going to look at a food label and you see a list of ingredients, just forget it. Because there's no healthy food that has a laundry list, a litany of ingredients. So I was going over with some of my patients some of the foods that they thought was good, like a gluten-free food. And it had like 3 or 4 gums in it. And the gum is deleterious to people's gut. So if it has a lot of ingredients, it probably has emulsifiers. It probably has preservatives. It probably has things that you don't need. So there's not a long list if you wanted to eat an apple. It would say organic or not organic. There's not a long list on broccoli. There's not a long list on grass-fed beef. So I would truly try to avoid anything with a laundry list because it can't all be that good. It's kind of like trying to make a justification on all the different things. So it's been great so far. I didn't realize we're over 20 minutes. I'm going to start getting into some of the questions. Hey, Shanae, how are you? Thanks for asking so many great questions. For me, better muscle recovery with good sleep. Absolutely, that's a great point. I should have made that point also. Better muscle recovery with good sleep, without question. Better muscle recovery, BPC 157. Epsom salt bath before bed, great choice. Shanae has a client that fasts but does not eat before a workout. What about cardio before you stop fast? Your fast stops. So that's an excellent question. So many people ask that. What about fat? If you're going to fast, can you do cardio on an empty stomach? Sure. If you get up at, let's say, 6 o'clock and you have a black coffee, remember, you can't have anything in the coffee, and 6:30 you decide that you want a cardio for a half hour, an hour, and then you make breakfast, so be it. I don't have a problem. The window between 8 and 4 to 8 and 6 is still held. It's still early in the morning. As long as you're fasting and cardioing first thing in the morning, you're not waiting 8 hours to do so. The big problem is people wait too late. They push their meals later. And even though they're eating in a time frame, the data says it's better to eat early. Grandma was right. Always eat breakfast. Weight training, absolutely. People talk about weight training as they get older. That's a great choice. Absolutely. You want to weight train. It's funny. In their 20s, all you wanted to do was get big. All you wanted to do was show striations. You wanted to show your intercostals. Now you just want to hold on to muscle mass because it is one of the first signs of aging in both men and women. And, if you go into a gym, I'm not going inside. I have a gym in my home. I'm seeing so many people, interestingly enough, the guys are always in the bench press, which is not a functional exercise, and the ladies are always on the cardio, the stepper or the stairmaster. And sometimes I think they should switch because women do need the muscle mass also. They lose an equivalent amount of muscle mass to what men do. You need a combination. So again, if you have any questions on that, DM me. I'll answer that for you. I'll break down a little idea of an exercise and things like that. So if you have any exercise questions, please feel free to reach out. What supplements don't work well with peptides? I haven't seen any supplements that don't work well with peptides. Peptides are fine. And these are orally taken peptides. So if anybody has any interest or concerns or wants to know more about the peptides, feel free to reach out to me. I'll help you. Water. Yeah, Shanae says water. Absolutely. I mean, it's a hidden gem. We just don't drink enough water. We're made up of 70% water. Our brain is made of water. I've got my water right here. I got a shout out to Fit Grinds. Fit Grinds, organic coffee with functional nutrients. In the Fit Grinds, what you're going to get is you're going to get a pre and probiotic. There's another one that's called Focus that has 3 different ingredients that's going to allow you to focus. Right about now, when I'm done with this, I'm going to be a little drained. pop a little thick grinds, focused coffee. We also have a collagen. And guess what? We have an immune one coming out in the next couple of weeks. Shanae, that's a great choice. Count the chemicals. That's right. I don't count calories. I count chemicals. It's all about the chemicals. It does not mean that calories do not matter. It doesn't mean they don't count. What it means is there's such a tier that chemicals, nutrients, satiety. You can have 400 calories from a cup of Frappuccino coffee. How much broccoli would you need to get there? So again, the nutritional value between the two would be quite vast. It would be unleveling. The coffee would be up here of much more calories in the coffee versus the broccoli, but look at the nutrients. So again, it's all about nutritional value. Hey, Shanae, thanks so much. I love that. I love that you love the hacks. It was something that I worked on. I hope everybody else enjoyed the hacks. Give me some feedback. Love to hear from you. What was the organic coffee? It's Fit Grinds, fitgrinds.com. Go in if you pick one of them. If you order $40, which is 2 bags, it's a discount. And Ava, I really appreciate it. I'm happy you like the health hacks. It's been my pleasure, and hope to see everybody real soon. I'm Dr. Rob Silverman, always yours in health.